Welcome to Focus on Health, a series of educational programs highlighting current health issues sponsored by the Department of Nursing at Salisbury University. I'm Dr. Mary DiBartolo, Professor of Nursing at Salisbury University and host of the program. I welcome today Carol Zimmerman. Welcome to the program.
Thank you. I'm pleased to be here.
You are the Development and Community Relations Coordinator for the Alzheimer's Association, which has an office located here in Salisbury at the Max Center.
That's correct. We have an office just down the road here a little bit, and I am there 3-4 days a week and available to people. And we have a phone number here locally you can call, as well as a phone number to reach me and a 1-800 that I think we'll put up in a minute.
Well, thank you for coming in because we have some very important things to discuss.
We do.
And first is, Alzheimer's disease. I think most people know more about Alzheimer's disease now. It's out there. I think it's one of those problems that's taken years for people to truly understand the significance of it in terms of prevalence and so on. And I know you have some numbers to support that on how prevalent Alzheimer's is now.
And you're right, Mary, that I think people are more aware. We need to make them even more aware than that. But I think in the past people weren't quite sure what we called it. We called it senility. We thought that people were crazy. Now we understand it's a disease.
Yeah, we did call it senility or organic brain disease, or many people thought it was just a normal part of aging. And we know right now it is not.
And the Alzheimer's Association not only covers Alzheimer's disease, but other forms of dementia like Lewy body's disease, vascular dementia, anything that's really related to dementia, memory loss.
And then frontal temporal dementia is the other one.
That's correct. And I think I'd like to tell the audience a little bit about some of the statistics through our flowers. We use these flowers in our walk, and they symbolize different people. Blue are for people who have Alzheimer's. And currently in Maryland there are more than 99,000 people who have Alzheimer's. And those are only people who have been diagnosed. Unfortunately, many people are not diagnosed with Alzheimer's disease, but do in fact have it. The next flower is our purple flower, and purple signifies people who, in memory of someone who has died of Alzheimer's. And unfortunately that number is growing rapidly. It's the 6th leading cause of death in the United States of the top 10, and it is the only one of which there is no cure or prevention right now. It's something we're working on, and we'll talk about that in a little bit.
Yeah.
Every 67 seconds, someone in America is diagnosed with Alzheimer's disease.
So Carol, what are the numbers with regards to the prevalence of Alzheimer's disease?
Well, Mary, unfortunately, every 67 seconds, someone in America is diagnosed with Alzheimer's. And they predict that unless there's a breakthrough, by 2050, that will be every 33 seconds. So we're talking about millions of people.
Yeah, no, they're talking about 15 million or so by 2050?
That's right.
That's the numbers I always use when I do my presentations, because it's very scary.
It is very scary.
And that's because of age being the primary risk factor. The older you get, and we have an aging population with the baby boomers.
The more likely, and as you get older, and by the time you reach 85, then the likelihood of you developing it increases dramatically.
I think it's like 40% or so. If you
I think you're
85.
right. And but many more people are affected by Alzheimer's than just the person who has it. This very much affects families. Our yellow flower is for people who are caregivers, and these are not only just professional caregivers when people have to see or be in a nursing home or a facility, but spouses, children, significant others who live it day to day, very long days,
taking care of
people. So this number of flowers at our walks are growing dramatically as well.
Well, we refer to them often as the hidden patient, particularly when it's a spouse who's usually older themselves and they're neglecting their own health care needs with 24/7 care for a loved one with dementia.
That's right, and the toll can be great, and that's one of the reasons that, in addition, a part of our mission at the Alzheimer's Association is not only research to come up with a cure, but support and programs for caregivers and patients, really focusing a lot on caregivers, support groups, and different kinds of programs to help people who do have to do that daily care.
Before we get to all the wonderful services that are provided by the Alzheimer's Association, including their website, which is, gone are the days of going to an office to pick up brochures. There's
That's
so
right.
much information available online. Let's talk a little bit about, we talked about the risk factor being age. I do want to mention, you do hear of tragic cases. I mean, they're all tragic in my mind. I've had, family members that have passed away with Alzheimer's and so on. But you particularly hear about the ones in younger people.
Yes.
But that's very few compared to the large population. It's less than 5% get the early onset type, and that is the one that is strictly genetic. If your parent had it, you have a 50-50 chance. So I do want to clarify that the majority of cases are happening in our older adult population that we do need to pay more attention to.
We do, and you bring up a good point, because natural part of aging, I know it happens to me, you occasionally forget, where did I put my car keys, or
where did I park?
Where did I park? In fact, that's yes, exactly.
Happens to me all the time.
Especially in those big parking lots. And that's normal, or naturally part of aging. But in fact, I think lots of times as people misread some of those signs, and it's important to know and to be diagnosed if some of those signs are more severe than that. One of our efforts is to try to get more primary physicians to do some testing, cognitive testing, as part of our checkups when we go there. Just like we find out of our blood work if we have diabetes, or take our blood pressure, things that will help prevent further disease. So would cognitive testing. And so I think many primary physicians now don't include that as part of their checkup.
Yeah, that's a good point. I know you mentioned sometimes you misunderstand the signs, or I also want to mention that it's very common, and I've been guilty of this myself with my family when my mother started showing these signs. I mean, you almost can go into denial,
yes.
Because many people know there's no cure. It's a very devastating illness, and it's sometimes just a reaction to overlook it and to be in denial that it's happening.
You're absolutely right, and I think that's maybe another reason, I'm not sure, why perhaps primary physicians are not doing as much with it, because they don't have something to fix it. They don't have a cure to fix it. And so they don't quite know what to offer to families going through that. So that is very important, to be able to recognize what are some of those signs and not be in denial. I think maybe when we talked about Alzheimer's 20, 30, 40 years ago, people kept it a little more hidden. Now hopefully people are willing to talk about it.
Well, one of the reasons people should get the evaluation is dementia. I mean, this is a common error that people make. Dementia is the signs and symptoms.
That's right.
And we'll talk about what they are. The Alzheimer's has published a list of 10 things that should arouse suspicion. But people should get evaluated because there's over 75 different conditions and illnesses that can cause those signs and symptoms. Now, unfortunately, the number one cause in about 60 to 65% of cases is Alzheimer's disease or related irreversible dementia. But there is a chance, it could be something else, it could be reversed or, treated.
That's right.
So that's why people should get evaluated.
Absolutely, and memory loss and dementia is such a vague term for people that they don't necessarily always know what is it connected to. So you're absolutely right.
Yeah, we'll get to that. And the other thing is the uncertainty. I think it's always better to know what's causing mom or dad to act a little differently, get the education and support that you need, plan ahead with advanced directives and future plans based on if the diagnosis is Alzheimer's or related dementia. There's just so many reasons it's smart to get people evaluated and to catch it early. There are a few drugs we can try that may help cognitive functioning for a short period of time, before someone
absolutely, and
hopefully
as we gain additional research dollars, some of those drugs, maybe even newer drugs coming out. So that's our hope.
And we'll need to mention that later. There's
Yes, we
been
will.
some big news in Congress of late about some funding for research in
That's
Alzheimer's, getting more attention. So, but let's get to the signs, the
Okay.
10 warning signs. And the Alzheimer's posts this on their website. And
They
you
do.
also shared a wonderful brochure, Know the 10 Signs. And what I like about it, it differentiates between what are the signs, and then for each sign, what would be the typical age-related. You know, our minds do, go downhill, just a tad under normal conditions.
That's right.
And, you can't remember things as well, or you get a little forgetful about where you left your car just recently, but it's, knowing what the keys are for. People say, well, I lost my keys. Well, what are the keys for? So there's significant differences between the memory loss associated with Alzheimer's and normal age-related changes. And of course, number one is memory loss that disrupts daily life.
That's right, and I think that's not necessarily easily defined, but I think people know, particularly companions and caregivers know when things are that's more frequently, they asking the same question. I just answered that question 5 minutes ago, 20 minutes ago, and that it happens more and more
5
frequently.
seconds ago.
5 seconds ago.
My mother was all the repetitive questions.
The
were really
repetitive
issue.
questions, and that's, and the getting lost. Particularly, that's a big
Driving. is a
driving,
huge issue too.
and that's sometimes when people realize this is more serious than maybe just the occasional memory loss.
And number two is challenges in planning or solving problems. And this is where we see people just struggling with day-to-day life. We all have that front part of our brain in particular drives the train, so to speak. I'm going to get up, I'm going to go here, I'm going to do this, and that starts fading.
Losing that capacity to really make some of those daily decisions. Never mind the big ones. You might notice them if the person has been in charge of the budgeting for the household. Maybe we forget to make a payment one time, but now everything's all messed up. Mm-hmm. So those are signs.
Difficulty completing familiar tasks at home, at work, or leisure. We talked about that. Confusion with time or place. We forgot to clarify that with memory loss, it's typically short term. And that will throw families off too, because many people in the early stages can remember things they did 40, 50 years ago,
very
but
clearly.
they can't remember what they had for lunch, a half hour ago. So that's a huge discriminator there. It's short-term memory is affected primarily first.
That's right.
Trouble understanding visual images and spatial relationships. New problems with words and speaking or writing, and it starts out with trouble finding words, and then it gets to where they can't put a sentence together, and then of course late stage they may not be able to speak at all.
That's right. I think you've really described the progression very well.
And then misplacing things, losing the ability to retrace steps.
And that's probably important. How many times have I said, now where did I put that down? Mm-hmm. I went there, and I picked,
and you find it.
And you find it. It's that not being able to remember and retrace your steps, I think, is significant.
Mm-hmm. Decreased or poor judgment. And also, especially when the frontal lobe is affected, people lose that social filter, the judgment of, I'm not going to undress in public. I wouldn't say that to someone. And people with Alzheimer's lose that social filter, and they'll say some things that are very inappropriate. They get hot, they just start undressing, not realizing they're in a social setting. These are middle stage signs, but nonetheless, families can get very uncomfortable with that piece.
That's right, and I think part of what they're trying to understand now a little bit, particularly in the middle stage and late stage, is that some of that sensory thing you were talking about really changes for people, and that's sometimes why you hear about patients refusing to bathe, take off their clothes, so some of that are all things that should be warning signs.
And you mentioned sensory, and that has to do with the driving too, becoming
right.
a big issue. And I know the Alzheimer's website has a good bit of information about what to do when it's time to say they can't drive.
They do. I think anybody who's watching now who thinks, this is sounding a little familiar, mm-hmm. Or I have these concerns. The website, which is posted there on,
we'll put it at the end.
Which is the Alzheimer, alz.org/Maryland, is a great place to go and find out a lot of information.
We'll provide that.
Good.
And number 9 is withdrawal from work and other social activities. And we see this a lot. Depression can accompany it early on too. And I feel people just feel that they know something's not right and they're uncomfortable being out in the social setting.
They do, and that's probably one of the tragedies, particularly in the early stage, is that in fact people do withdraw, and it's hard to tell, are they just depressed or something else is going on. But in fact, they've had lifelong friends and people that they no longer feel, and friends aren't feeling comfortable with them.
I know.
And so some of that about how do you support people and how do you provide places that are safe and comfortable for them to go to and have that contact.
And then changes in mood and personality. We mentioned they can become confused, suspicious, depressed, fearful, anxious. All those things can accompany Alzheimer's disease.
That's right.
So those are the 10 signs, and of course we mentioned earlier, so important to get an evaluation or start with your primary care physician. I have these concerns, this is happening, and this is not something the patient's usually going to mention.
That's right.
They are unable to remember or mention it, or they are in denial themselves and don't want the physician or anyone to know that they're worried about these kind of things.
In all diseases, I think patients need advocates, but in this particular disease and in this, advocacy is so important for family, caregivers, and people who understand to be able to help articulate for the patient and to be able to search out resources and to get some of their needs met. And sometimes that's very hard for a caregiver, a spouse, or a child, a daughter, son to do, but they need to know that they have to be, that the patient can't often speak for himself or herself.
So hopefully we get people to talk to their primary care physician or the family to make them aware. And, it's preferable, I think most of the literature says, to get a very good dementia evaluation, which is a comprehensive workup that involves, getting your blood drawn, certain scans, and various other tests, including cognitive testing.
That's right.
To either rule out Alzheimer's and there's some treatable or other cause, or to say it looks like it's Alzheimer's. And then, even though we don't have a cure, you can move forward with knowing, explains the behaviors and so on, and then family can get the support and information that they need.
Absolutely, and you mentioned earlier about planning. That's very important. At this moment, there is no cure, so planning is especially at a time when the individual may still be able to participate in that plan.
Right.
And what his or her desires are.
What they want done, what they don't want done at end of life. Yeah, I think that's very important. That's one good thing. We got my mother diagnosed, and she was able to articulate that, she didn't want any drastic measures and so on. She died rather peacefully, and to me, that was a wonderful gift. So.
It is.
So let's talk about what the Alzheimer's Association has to offer the community. And first is trying to get the awareness out there of what it is. And I think it's finally starting to turn the corner a little bit.
I hope you're right.
I know one thing that's impressed me of late is, I work at Salisbury University, and they've started an Alzheimer's awareness as a campus club. So that means young people are starting to recognize through grandparents or whatnot that this is going to be a healthcare crisis someday, and that we need to get the word out about what we can do to help and advocate and so on, participate in fundraisers. So I think we're starting to turn a corner a little bit. I mean, we have a long way to go.
Absolutely. I was thrilled when I met the young man and he had a team at the walk this past October, and he talked about his grandparents, and I suspect that the members of the club all have some, unfortunately have somebody, but at that age to not, to not be kind of self-centered, but thinking forward like that it was very exciting.
Yep.
The Alzheimer's Association has a vision, and that vision is a world without Alzheimer's, and our mission is not only to provide the resources and to advocate for research for a cure, but to provide services for caregivers and patients during this time.
Well, I know one of the things you do, because I speak at it occasionally,
That's right.
is your annual Caregivers Conference, which is bringing in speakers, experts to talk about various issues. It's a one-day conference usually held each March, and I know it's well attended, and it's just a great opportunity for local caregivers to get the up-to-date information.
Absolutely. It's that we will be having one again this March, and please visit the website to find out exactly when. There are several all over the state, and as you said, they're for caregivers, and they have some very knowledgeable people like yourself providing some real life help and tools for people to cope and to understand, and resources about where to go for some of the testing you were talking about, for other kinds of services.
Yes, and I know the Alzheimer's Association can't promote certain things, but obviously there is a dementia clinic located in Easton,
That's
which is
right.
only an hour from this area.
That's right.
And then, of course, many people choose to go across the bridge to either Hopkins or whatever to get a full workup. I mean,
And we're very fortunate in having John Hopkins and the clinic, the dementia clinic in Easton, with such great resources there.
Yep. Now, advocacy. Talk a little bit about that. I know you wanted to really touch on that, and I think
did.
there's some good news in Congress now.
There is,
Finally.
and I want to talk about advocacy because I think even if you're not directly affected, you don't have somebody, and it's getting rarer and rarer that you don't know somebody or have somebody that's been affected by it. Being an advocate, it means supporting the cause and speaking out. And one of the ways to speak out is that the Alzheimer's funding for Alzheimer's disease research has been amongst the lowest. Just has not been much funding, federal funding, and national health funding. But this year we're very excited that for the first time Congress has included in their bill $1 billion, which we need lots and lots more, but that's a huge step. And it's thanks to all the people who have called or written to Congress members to say, this disease is growing, there's no cure, it's the 6th leading cause of death, and it is so badly funded, and please step up and do something. And in fact, I think Congress is starting to listen. And that's the only way we're going to get. The Alzheimer's Association itself contributes money to research. I think it was $14 million last year that the organization devoted, but it has to come out of federal funding. It's the only way we're going to make the advances as we have in cancer and some of the other
and
kinds.
HIV/AIDS and all those
that's
things.
Right.
Yep.
That's right.
It's now a chronic illness. It formerly was a terminal disease. So we're hoping the same will happen for Alzheimer's.
We absolutely are.
So that's a big part of what the Alzheimer's Association does. The other thing is just events to both raise awareness and funds.
That's
and
right.
I know each October you have a memory walk or walk to end Alzheimer's.
Yeah, walk to end Alzheimer's. That's where we carry those flowers. And we were this year. The state raised over $1 million from 6 different walks. One was here in Salisbury in October, and we had 510 people, I think it was,
great.
show up. It was a huge crowd. It was at the Mac Center, and we have a short walk and we have a longer walk, and people were very generous with their money, and we've raised $80,000 here. But most of that money goes into either research or stays here for local for.
Another fundraiser I want to mention through MAC that I'm involved in is we have an annual St. Patty's Day race every March, and that money that we raise goes directly to helping respite, to providing funds for those caregivers that need respite care.
That's right.
They can bring their loved one to MAC and have a few hours to do what they need to do and have a break.
And the person with Alzheimer's is in a secure environment, and so having that break for caretakers is so important.
The other thing you mentioned that I hadn't heard of is Purple Weekend. You're saying that's held each June. I'm a Ravens fan, so I know of Purple Fridays, but this is Purple Weekend. Purple's the color for Alzheimer's.
Right.
So tell us about that.
It used to be Purple Sunday, but it's now Purple Weekend, and it encompasses all faith-based organizations. And we're going to be reaching out to the various churches, synagogues, and asking them to include in their service something about Alzheimer's, and to have a table after the service for people to have. We'll provide all the information so that more and more folks, people who are interested in will know more about it. And the leadership of the churches and the organizations will be more knowledgeable about where can they go, where can they tell somebody. Sometimes that's where you go. If you've trouble with something in your family and you talk to your pastor, your rabbi, your priest, and having that leadership know what number to call, where to send somebody. That's kind of our goal.
And let's talk about a few other things the Alzheimer's Association does. And of course, here locally, support groups are a big piece. And MAC, of course, offers support groups.
That's right. We offer support groups. The Alzheimer's Association does, but here in Salisbury, support groups are offered by MAC, and they just need to call either our 1-800 number that you'll see, or the MAC Center.
And of course, they're all over the Eastern Shore.
They are.
Every community pretty much has one. And they're primarily for caregivers.
That's right.
But they can bring their family member, have respite care provided, and just sit with a group for an hour or so. And
it's so important, Mary, just to be able to share, even just to let out, I'm so frustrated. I don't know what to do about this, or how the tips, how do I
share
cope?
Caregiving tips.
Tips, and people have them, you know, learning by experience.
Exactly. And then what about the helpline? Tell us a little bit about the helpline.
Yes, we have a 24-hour, 7-day-a-week helpline, and be on the screen there, and you can call anytime. That's during the days. That's personed by our folks in Maryland that are either professionals like yourself or people who are skilled volunteers who have gone through it, and they will provide you with either resources or talk and listen or whatever you need. The rest of the time it's done nationally. There's a live person at the other end, but we will hear back. If it's somebody locally, we'll hear back so we know how to follow up. We know that that you needed something or you needed some information, and we'll make sure you get it.
And one thing we forgot to mention that I know the Alzheimer's Association has been heavily involved in is the whole issue with wandering.
Yes.
So tell us a little bit about that program where family members can have more peace of mind that if their loved ones should leave the secure area of their home or whatnot, what's available there.
We have information on our website about what to do in that situation, and wandering, unfortunately, for some patients, and they'll just lose their way, and how do you deal with it? Again, that 1-800 number is one of the things you would do.
Is there a program, a bracelet or ID? I thought
there's an alert
bracelet.
Yes,
yeah.
That's right. And a medic alert bracelet that you can acquire, put on.
That's important.
That's
so
right.
If you run into someone and you're not quite sure,
and then they also have
a
safe return project. So you can find out more information about that on the website.
That
as well.
Can give a family great peace of mind.
That can, because you can be scared to death. Just leave for just a second.
Okay, well, thank you so much, Carol, for all the information.
I really appreciate your doing this series on health, and also particularly on Alzheimer and dementia. And if anyone, again, has questions, please call the 1-800 number. And hopefully we will.
And then you do have a physical office at MAC.
We do, and I am there to.
Because you have a lot of the publications, but people can also access them online.
And I'm available to come out to a group if a company has employees that would like to learn more. We have a corporate workplace alliance stuff. So many employers that have employees whose families are affected.
Sure. So I guess to wrap up, we'll emphasize, I think the 3 points we made is recognize the symptoms early.
That's right.
Get the person evaluated, and the good news is we're trying to get more primary care physicians to just do the screening to pick it up sooner versus later, because many times families are in denial or it's difficult to ascertain or understand. And then, of course, the wonderful resources available.
That's right. And learn about
through the Alzheimer's Association and at MAC.
That's right. And I really appreciate you having me on your show today.
Well, thank you for coming.
Good.
And thank you for joining us for this edition of Focus on Health here on PAC 14.